Cases of COVID-19 have risen dramatically throughout children in the state of Alabama over the last few weeks. And the number in schools in particular is skyrocketing. I'm Count Gasquet with Children's of Alabama. Welcome into our Zoom roundtable discussion about COVID-19 in schools. We have three medical experts joining us today to talk about this topic. The three experts we have: Dr. Julie Wolfson, pediatric hematologist and oncologist at Children's of Alabama and UAB; Dr. Candice Dye, pediatrician in the UAB Pediatric Primary Care Clinic at Children's of Alabama; and Dr. Jennifer McCain, assistant professor of pediatric emergency medicine at UAB and Children's of Alabama. Doctors, thanks so much for joining us. We'll talk more about your specific roles in just a little bit. But first, I want to get your comments on the recent surge in cases that we've seen. A number to throw out to you here. According to the Alabama Department of Public Health, these are the most recent numbers that we have from them. We've had more than 26,000 COVID-19 cases in Alabama schools over the last week, which is up from 16,000 the previous week and just 2,900 the week before that. So those numbers really put it in perspective, the exponential rise that we've seen in COVID-19 cases in Alabama schools, really in just the last 2 weeks. You talk about going in a 2-week span from 2,900 to 26,000. I want to kind of get a perspective from each of you about what those numbers say to you. Dr. Wolfson, I'll start with you first. What jumps out to you when you hear those numbers?
They're really high, right? I mean, I think that, and not to make light of it, but when we think about what that means, you know, at the population level, we say, you know, high risk of transmission is more than 100 cases per 100,000. And we've had over 1,200 or 1,300 per 100,000 in Jefferson County for a long time now. And those are exponential. It's not like we're calming down right now, right? I mean, when we have this school rates, as you said, these infections have really been blasting off. I hate to use that terminology, but it's concerning. It's very concerning to me, big picture. I think I'd love to hear what Dr. McCain has been seeing in the emergency department and how it, and I think that may be a really good window into this.
And that's a perfect segue. Dr. McCain, what have you been seeing in the emergency department?
Yeah, I couldn't agree more. Exponential numbers, skyrocketing, those are definitely words that describe what we're seeing. You know, we've definitely seen children with COVID throughout the entire pandemic, but nothing on the order of what we're currently seeing. I cannot go a shift without seeing several children who are being evaluated for COVID. And I think pretty much every time I've worked in the last 2 weeks, I've seen children that I've had to put into the hospital probably 2 to 4 times a shift. So 2 to 4 children per shift that I'm working an 8-hour shift are needing to come into the hospital. It's a wide range of problems that we'll see from kids. Just like we've all heard from the very beginning, there isn't one presentation that you can expect to see with COVID. It goes truly across the board. It can affect children who are completely healthy. It can affect children who have mild illness already. And it can affect our most vulnerable children, who we certainly worry the most about, patients like Dr. Wolfson's patients in the hematology oncology clinic, all the way up to kids with cystic fibrosis, other kind of immune deficiencies. But the typical kind of patients I'm seeing that I'm having to admit are babies who are under a month old, who have fever. Frequently the cause of that fever is COVID. We've had children with febrile seizures who have been found to have COVID as well. We've had children who are having seizures that aren't associated with fever. We've had children who already have seizure disorders who having COVID is just another instigator of causing their seizures to increase. We've seen children who have diabetes already who, again, the virus, it causes them to have increased metabolic needs, and their blood sugars frequently get out of control. And several of those children we've had to admit to the ICU because they're having such problems. We've also had new onset diagnoses of diabetes that we found to be associated with recent COVID illnesses. That number has truly skyrocketed last year. Certainly, we've had kids with stomach virus symptoms and becoming dehydrated. It really does go just across the board of most of the medical reasons we see patients in the emergency department. COVID has been at the base of why they're sick.
And
It's kind of seem
skyrocketing,
like- yeah.
skyrocketing kind of seems to be the theme here when you talk about these numbers. Dr. Dye, I want to get your perspective as well about when you think about those numbers and how quickly it's risen just in the last 2 weeks. What crosses your mind?
It's a mess. I know that that's not, very scientific, but it is. And, I mean, like you said, I work in one of the pediatric outpatient clinics. I also attend on the inpatient side. And my division also covers the nursery. And I mean, it truly is everywhere. And, we are testing in clinic for symptomatic patients. But I mean, we've had to scale back on other visit types to make room for the volume of sick patients that we are, those acute visits that we're seeing that, need that testing and need that exam to make sure that they, are okay to manage symptomatically at home. So it's just, I mean, it truly is everywhere. And our test rate, as of last week, was over 50% positive of those that we were testing in our clinic.
And I
And
wanted to go
I
ahead,
was going
Dr.
to say, the only thing I was going to add to what they both shared was that I think a question that I get so often is, but aren't so many of the kids that are in the hospitals actually admitted with COVID instead of for COVID? It's become this conversation where is it incidentally picked up or are they actually sick? And the data suggests that more than half, over 60% of the kids that are admitted to the hospital that have COVID, they're admitted because of the COVID. They're actually sick from it. It's not that it's just happenstance. And the latest national data from the American Academy of Pediatrics, actually, I just glanced at as well to make sure that I was remembering it correctly. And the vast majority of these kids are not vaccinated as well, the ones that are getting sickest. Just to throw that out there, I imagine that's what both Jen and Candice would say in terms of their experience hands-on as well.
Absolutely.
I totally agree. I mean, certainly there's those, newborns clearly cannot be vaccinated, but their mothers can prenatally. So we certainly recommend that happening. We know that it's safe for pregnant mothers to be vaccinated, and that does actually help these little guys. And the other children who are under 5, there isn't an opportunity for them to be vaccinated. However, the other older ones, 5 and up, we're ready and willing and able and pleading with 5 and up to get vaccinated. It's not too late. I think there's a lot of discussion of we're about to hit the peak and things are going to get better. And I think that makes people feel, okay, well, we've made it through this far. We're doing pretty well. I just would really disagree with that thought process, and would highly recommend anybody who has children with this age group, go talk to their pediatrician if you have any concerns. But I don't know a pediatrician who wouldn't say to get a child vaccinated. I think that we're all pediatricians in general. We love to prevent problems more than treat the problems as they come up. And this is the ultimate level of prevention, that we can keep these kids from at least needing hospital services by getting these vaccines into them. They may still get the virus. And that is, that's another point that I think people have been concerned about, that, oh, I know so-and-so had the vaccine and their kids still got COVID. Well, that's absolutely true, that we won't necessarily make every single person be unable to get the vaccine, to be able to get the virus, but we can feel comfortable that we are protecting them at the greatest degree from getting admitted to the hospital or having more serious problems from COVID.
So very important for people who are eligible to get vaccinated. But Dr. Dye, as a pediatrician, what advice would you have for parents of children who are under 5 and not able to get vaccinated? What's the best thing that they can do to keep their children safe right now?
Themselves to get vaccinated, and anybody in their household, in their family, anybody they know to get vaccinated, please. And just to kind of to add on to what Jennifer was saying, with the peak, and hopefully we are hitting that soon. I think we're definitely lagging behind some other parts of the country, but until we get more people vaccinated, there's going to be another variant, and who knows what that variant will look like. And the only way to stop the just mass chaos of this, and to prevent these just senseless deaths is to get more and more vaccinated. I would certainly encourage like we've said, for those parents to please have that conversation with their pediatrician. I've said this before, but I've had numerous conversations with parents. There is so much disinformation out there, and it's who do you go to for medical advice? You go to your doctor. You go to your child's doctor. You don't go to the internet, the latest social media, fame, person. You go to the professionals. Just like, I think we all have, different, analogies. I don't take my car to a banker to get fixed. I take it to a mechanic. We are trained in this area. So please listen to us and just have that conversation. I've, can remember very early on, just completely debunked this this concern from a parent, and she was so excited to know that what she thought she knew was not true, and she's like, well, I gotta go tell my friends. And I'm like, please do. And so just go to the actual professionals, experts, to have this conversation. And hopefully that is your child's pediatrician that you do have a relationship with and do trust them. You've taken your child there for a reason. So continue to have that conversation and be a part of that, just very important decision, and to help stop this.
And I imagine Dr. Dye gives the same advice to the parents of babies that I do to our immune compromised patients who we offer vaccine and we encourage vaccine amongst them, but they don't have as strong of a response to it necessarily. And so we do the same thing. We really encourage the families to get vaccinated, but we also encourage them to wear a mask in public indoor spaces and to ask their siblings to be wearing a mask at school, et cetera, and to make sure that they're distancing and not going in large gatherings, et cetera. And if they have to be in spaces with a lot of other people, make sure they're wearing a well-fitting mask.
And I know there's new guidance out there from ADPH about returning to school, isolation periods, various things like that. And I know there's a lot of if-then scenarios about doing this under that circumstance and that under this circumstance. And I know some people, may feel a little bit confused by it, but I guess the important thing, Dr. Wolfson, is making sure that children are doing those things like masking and social distancing, regardless of what their circumstances.
It's hard, right? And I think that we all have to admit that school is hard because of peer pressure. So I think that if all the kids are wearing a mask, it makes it easier on their neighbors as well. And masks work best if everybody wears them. So really encouraging kids to be wearing a mask when they're at school, and families to be doing that when they're in indoor spaces as well. And thinking about also the fact that, after school extracurricular activities count as school too, right? You're with a lot of other kids, school-aged kids, often from the same school, sporting events, et cetera. And really thinking about that these are times you're around a lot of other people. And my gosh, we're sitting at a 40% positivity rate for Jefferson County. We haven't seen that throughout the pandemic. That is so much higher. You are bound to be sitting next to someone at some point that has COVID. So really preventing to bringing that back into your own home really is a mask is incredibly effective. I know there's a lot of myths out there that we all spend time debunking, but there's a lot of papers and science out there that really supports the fact that masks work, but they work when everyone uses them. I think the fact that there's this new 5-day guidance, right there, and it's really meant to encourage the workforce. It's meant to keep adults at work. And so keeping adults at work and kids in school so adults can work means the economy keeps going, and we're not going to lead to a shutdown. But so it's great that we can all get back out there again at after 5 days if in certain scenarios, when we have mild symptoms or no symptoms. But thinking about the fact that, when we used to do those 14-day quarantines or isolation, we would only send 1% of those patients would still be positive and infectious when they went back out into the world. Cutting it down to 10 days, we still have about 5% that go out there still infectious. 5 days though, 30% of these kids are still infectious. So when they go back to school, really wearing a well-fitting mask, not eating with your peers, finding a different place to be eating, things like that. Not taking your mask off at PE, not doing band, where we're going to share a lot of those particles with the rest of the room.
Part of those recommendations that if your symptoms are, improved, gone, without fever, that, and that you can return, you have to wear that mask. And if you can't, then you can't return. And I actually, had a conversation with a friend that has children that have, gone through this, but with a daycare, and, that, just as a whole other, beast, just because that population isn't even eligible to be vaccinated. And then, a lot of those children, can't keep on a mask properly. But there is a very large population that is eligible for the vaccine, and a very large percent of our population that can wear a mask, and can do so. In the medical community, we've been using masks for forever, and they work. So, it's not rocket science. Early on, we were able to stay in school because some of those were more enforced, but we know that they work. And Dr. Wolfson and I have children the same age, and there's always this conversation about well, are they wearing a mask? Is so and so, and going back after the holiday break, my youngest child said, well, is who else is going to be in a mask? And I maybe said something a little bit more sternly, but I said, I need you to be wearing a mask. I need you to protect yourself and to protect those around you. So
I think you're hearing some pretty big themes here repetitively from each of us that you probably have heard throughout the pandemic. But I think we all stand behind these same very basic tenets, I think, of prevention of problems. One, please wear that mask. That's your immediate, going to help you right now today, benefit and really encourage not just your child, but your friends who have children the same age, your grandparents, your everyone who's 2 and up can really do this. It doesn't matter if they have asthma, doesn't matter what other conditions they have. Really, I think all of us getting comfortable with the mask for hopefully just a short amount of time is going to make a ginormous difference right here in the next few days and weeks.
And as we continue to hear, or go ahead. Finish.
Oh yeah, so I was going to say, second, keep that distance up, and I think that keeping a little space between you and the next person, it still is so important. It's simple, but it really does make a difference. I heard some statistics. I know we're all sick and tired of statistics, but this one seems very basic to me. That right now, with our rates being what they are, if you have a room full of 10 people in Jefferson County, your risk of being around someone who has COVID and then likely to get it yourself if you're unvaccinated is 70%. So room of 10 people, you have a 70% chance of being around someone who has COVID. Make that room 20 people and your risk is now 90%. So that is not a small number by any means. That is extremely likely situation. And I think that we're all seeing that version kind of happening currently. And then my third one is the vaccine. My goodness, we've all said it over and over again. And I think that I really want people to get very comfortable with hearing us say this. This vaccine is safe. It's been tested more than any vaccine has ever been tested in the history of vaccines. We all feel very comfortable with it. We feel very comfortable encouraging our families, our children to get it. But certainly our patients that we love and adore, we really care for, we want the best for them. We want them to get their vaccines too. So my child got his. I know every doctor I can think of has gotten their kid a vaccine. I want families to hear that that's I'd love to see it be the norm, that's the situation and not the exception, which I think right now, if you look at our numbers in our state, it is certainly the exception for children to have had a vaccine than the rule. And they're available, they're free. You can find them at your local pharmacy, you can find them at the grocery store, you can find them in your doctor's office. So it really shouldn't be, there shouldn't be big hurdles for people to get those.
And it's tough because even though almost 9 million children between 5 and 11 have gotten the COVID vaccine, it's still 80% of the, almost 80% of Alabama kids have not, right? And so 80 out of 100 kids in Alabama have not gotten that COVID vaccine if they're between 5 and 11. It's really, really important for us to emphasize how safe and important it is. And that's the best protective preventive measure we can do. My kids have been vaccinated too.
Yeah, on that, I'll give a little plug. The primary care clinic has partnered with Children's, and we have a community COVID vaccine opportunity. So, when the vaccine was approved for that 5 to 11 year age group, a lot of practices weren't real sure if they were going to be able to, to have the supply, to get the supply, and so forth. And then for, hopefully what's a smaller percent of the population that doesn't have a PCP, then they are able to get it through our clinic. So I'm not sure if you could provide a link, or if there's a phone number too that patients or parents can sign up for that, and we will be more than happy to vaccinate not only our own patients but anybody else in the community that wants one. So
certainly a lot of good advice today. One thing that I want to hear from each of you, I want to get each of your perspective on this is, and you've hit on it a little bit so far, but we do keep hearing about maybe there's a peak and the numbers are going to start to fall off. But how important is it for everyone to remain vigilant going forward, regardless of what they're hearing about that possibility? Dr. Wolfson, I'll start with you.
I'm sure you'll be shocked that I'll say it. Very important, very vigilant. We may be, my husband and I keep joking. He's like, do you think we're peaking? I said, maybe plateauing and maybe a mesa. We're getting flatter. We're not as skyrocketing in the community as much. Clearly we're skyrocketing in the schools with those dramatic numbers you shared with us, but we're plateauing. We haven't started going downhill yet. So it is incredible that even though that's a plateau potentially, we're not really sure what that means yet. The hospitalizations are continuing to rise, which is what we see as well. It's incredibly important to stay vigilant and not let your guard down. And I know, gosh, we are all so sick of this right now, and we're all sick of the masks, and we're all sick of the distancing, and we just want to go on with our lives, but we're not there yet. We'll be there. And I hope that there will be a time when we can go into these ebbs and flows, right? And we say, hey, for a couple of weeks, we'll do this, and it'll protect us from getting into the next surge. My hope is that once we get through this Omicron surge, we can find a way to prevent the next one from being quite so aggressive.
Dr. McCain, what can you add to that?
Yeah, I agree wholeheartedly. I think that we may very well be hitting a peak, but we're hitting a peak at a very, very, very high place that has not been seen before in children. But that's a peak in Birmingham, in Jefferson County. If you look across the state, the larger cities, Birmingham, Huntsville, Mobile, Montgomery, are definitely appearing to be at a peak. But if you look more in the rural areas, they are still on the upswing. So this is sort of how it's gone throughout the entire pandemic. The bigger cities first, then the kind of more rural areas. And as we all know, Alabama is a very rural state. So I really feel for those communities that haven't seen this yet, that have it coming. And if anything we can do, like I said, let's go back to those very simple, I hate to say simple because it's not that simple. I know it's not easy to do it, but basic maybe is a better way to say that. 3 things that we can do to really help our neighbors out, our children, our neighbors, everyone. Let's get that vaccine, please. Let's wear that mask for hopefully not much longer, and that distancing. And you really can go about your life when you've been vaccinated and boosted, for people who have eligibility for that. When you're masking, you can do an awful lot. that certainly there are things you can't. And I think if we focus a little bit more, particularly for our children, on, not here are the things you can't do, as, but you know what, we can still go outside and play. It's 45 degrees outside. Isn't that pleasant? Comparatively anyway. It's going to be sunny today. You can get outside and you can run your little legs off. Go get on that bike with your helmet, and go for it. So I think that we have, some positive ways to spend this. When you're talking to your kids, we all do this. If we focus on the negatives, it's going to spiral. But we can focus on the positive and get things moving more in the right direction mentally, and make the best of what we got.
Dr. Dye, any final thoughts from you about the importance of continuing to be vigilant going forward?
Yeah, I don't know that there's much that I can add that these wonderful colleagues haven't already said. But I'll just kind of repeat what I said earlier, that if we are hitting a peak or a plateau, it's only temporary until the next variant comes. And the way that we prevent that is vaccination. And in the meantime, we get vaccinated, we mask, and we distance. I think it is simple, but I'd agree with Jen that it's not, because I've again had those own conversations with my own children. But I just also kind of feel like that social responsibility, and to your neighbors and people you don't know, but to your loved ones. Right before the holidays, that was one of the things that we kept harping on at our house was, we're hopefully going to be able to see your grandparents, and we certainly don't want to bring germs to them, certainly not COVID, but anything else either. And it's just the right and polite good thing to do. So
the other thing I wanted to mention about the peak, as I'm thinking about it a little bit longer, is the big part of the peak is it took us X amount of time to get here, 3 weeks, 4 weeks, however you look at it. It's going to take at least that long, if not longer, to get on the other side of it. So yes, maybe we're hitting the peak, but let's just be careful for a little bit longer. Be thoughtful. That it is, peak doesn't mean over. Peak means slowing down, potentially slowing the rate of rise down. That we're still going to see lots of our friends and neighbors who are getting Omicron. And I think the other thing I would say about that part is that, for those families who've already experienced Omicron in their household, I hope that they've all done well, and most likely they have done well, and they've gotten through it. I think that some of the concerns I've heard from friends and family is, hey, now we've gotten Omicron, we're good, let's roll. We've got it behind us, we're set. And that may be true for a little while, but I would still tell you that we don't know what's around the corner. As much as I would love to be able to predict the future, I can't. But I would still recommend all those same things to families who have already experienced Omicron. Let's be still careful, let's be vigilant and cautious. And still, even if you've had Omicron, that doesn't mean you don't need a vaccine. You still do need a vaccine, even if you've had the disease. And unfortunately, as much as we'd like to say that natural immunity that you've gotten from getting the disease is enough, time and again, we've seen the data show us that that's not enough to just have had the disease. You need to have that vaccine too. And you actually really do get even better immunity if you've had the disease and the vaccine, but we don't need to try that out. So I wouldn't tell people who to try to get the disease ever. You're never going to hear that from any of us, to go and try to get sick. But for those who have been sick, let's go ahead and get that vaccine once you've gotten over it.
Running low on time here, so I thank everyone for their participation. Very good information and very good advice today, and very important for everyone listening out there to make sure you continue listening to medical professionals like the ones you've heard from today. Thanks, doctors, for your participation today. And there's always more information on COVID-19 at childrensal.org.